Welcome to Health Focus, where we focus on your health. I'm your host, Dr. Scott, and today we're focusing on World Hepatitis Day. This year that falls on July 28th, but really it's an area of concern throughout the year. In fact, the World Health Organization has sponsored only 8 health awareness days, and this is one of them because, in fact, worldwide we see 1.4 million premature deaths due to hepatitis. This is a real public health issue here in the United States and around the world. And we're very privileged to have with us today a distinguished guest, Dr. Emmanuel Obanor.
Thanks for having me.
Welcome to Health Focus, Dr. Obanor. And if I may make a personal observation, we've known each other for 20 years, and I've worked closely with Dr. Obanor in state hospitals and in various settings where we've tried to improve the care of hepatitis and address those issues.
That's correct.
Dr. Obanor is a superb gastroenterologist. He's a graduate of an osteopathic medical school in Pomona, and in fact did training in internal medicine and most recently gastroenterology at, I believe, Michigan State.
Yeah, Michigan State.
Highly respected in the community. Dr. Obanor is in practice in Stockton. And I imagine you're seeing quite a few cases of hepatitis as part of your overall practice, but you do more than just treat hepatitis, right?
That's correct. I do more than treating hepatitis. I also treat other GI diseases like inflammatory bowel disease, abdominal pain, and other gastrointestinal diseases that comes with the turf.
And I know that you have a real interest in helping underserved populations.
That's very correct. I do a lot of work in Africa every year. I spend 2 weeks of my time helping in Africa, mostly in Nigeria, not only educating the young doctors, but also seeing patients and treating them at the same time.
Well, we're delighted to have you here, especially since hepatitis is a problem that really presents in a different way in different parts of the world. Why don't we start by just talking a little bit about the basic issue of hepatitis. So when we say hepatitis, what do we mean? We mean inflammation of the liver, right?
That's very correct.
And tell us what the liver is and what it does.
The liver does a lot of stuff for the human being, so to say. It detox the body of toxin. It helps break down drugs and clear off drug toxin. Not only that, it does make some clotting factors. That is, when you cut yourself, you bleed, and then you notice the bleeding stops. These are from the function of the liver, who makes all these clotting factors, i.e. factor 2, 5, 7, and 10. But these are other things that are made in the liver that helps that. Also, the making of taking blood that has been broken down, which we call part of heme. The heme is now converted to become bilirubin. That is also done by the liver. And it's the bilirubin now that colors the urine to become yellow, at the same time colors the stool to become also yellow. So the liver really does a lot of things, cleaning the body of byproducts such as break down blood. Don't forget, our blood cells last 120 days, and then they are broken down and recycled. And it's the liver that does some of this recycling for us. We take a lot of drug in this country. We treat people for TB. The liver is very, very involved in also detoxifying some of these drugs that we take. So in actuality, the liver plays a very pivotal role in the care of what I call the stasis of the body.
It's really amazing. I mean, this is an organ that both helps for digestion by secreting digestive enzymes.
That's correct. Yeah.
But also helps us to maintain blood glucose.
That's correct.
And also detoxifies our blood when we and other substances that we might ingest. So it's really an essential organ. And the specialist in medicine that addresses liver problems tends to be a specialist in gastroenterology because the liver is part of the digestive tract, although it also has other functions.
That's correct.
And so we have the liver. We know it's critical. Without it, you really can't survive.
That's true.
It's in the abdomen, in the upper right part of the abdomen.
That's correct.
And it's quite massive. I believe it's perhaps only exceeded by the skin in terms of mass as an organ. It's just a tremendously large organ.
That's true.
Weighs what, about 3-4 kilograms or so?
Something like that.
Yeah.
Yeah.
And so it's an abdominal organ critical for homeostasis, as you pointed out. All right, so we're talking about hepatitis, inflammation of the liver. We seem to have developed a system based on assigning letters to different types of hepatitis. So what are the major types that we're concerned with in terms of infectious hepatitis?
There are actually 5 of them. So you have the hepatitis A, you have the B, you have the C, you have the D, and then you have the E. If you look at all the spectrum of this A, B, C up to E, you will see some trend where some are more prevalent in certain part of the world and some are less prevalent in certain part of the world. I.e., you have the hepatitis C more prevalent in the United States compared to some other third world country. Although that is changing now, because in places like Vietnam, where IV drug use is becoming very prevalent, we are seeing more hepatitis C as compared to hepatitis B. Then in Asian country, we are seeing more hepatitis B, mostly from mother to baby transmission. And not only that, the prenatal care in some of these countries are not well focused on. For example, places in Africa, nobody does any prenatal care. They literally are pregnant for 9 months and then the baby is delivered. But here in this country, we check for all this. And then if a mother is noted to have hepatitis B, the tendency to not only monitor them or treat them at a certain part of their pregnancy is there. Mm-hmm. And then there are also precautions that we can take during delivery that can prevent the mother to child infection.
And of course, it's worth pointing out that hepatitis need not be infectious. So for example, if a person ingests too much alcohol or Tylenol, you can get inflammation of the liver. There are inherited conditions that affect the liver. But we're focusing on infectious hepatitis here, right?
That's very correct.
So I'd like to suggest to you, Dr. O'Banor, let us focus on hepatitis A, B, and C.
Okay.
Because I believe those are the big 3 that are getting a lot of press that people are really interested in. Would you agree with that?
Somewhat I will agree that we are now also seeing hepatitis E, mostly in pregnant women. And when we see this in pregnant women, they tend to lead to fulminant liver failure and can lead to death. So the general public needs to be aware that there is a hepatitis E. And you see them mostly in third world countries during the monsoon area when there's raining, where sanitary condition is very, very poor. Hepatitis E is pretty much like hepatitis A in the sense that it does not lead to chronic infection. It's an acute infection. So it's there for a certain time and it subsides. But when you have this in a pregnant woman, it becomes a major issue. Today, where the world is becoming like a global place, people traveling in and out. So as a physician or as a nurse or as a healthcare person, a pregnant person from another country who is in front of you sick, and you're trying to kind of find out what is wrong with them. So hepatitis E may be something to be put as part of the differential when they present with liver issues.
Can it be transmitted to the fetus?
It cannot.
Okay.
Yeah.
And D is, I believe, a subviral satellite, so it tends to occur in the setting of other infections.
That's very correct. It occurs with B.
Okay.
You have to have hepatitis B to be able to get hepatitis D. And most of the time, people who have chronic hepatitis B that are doing very well, when they flare up, you may have to be worried if they are now infected with hepatitis D. But most of the people you see this type of infection are like immunosuppressed patients, people with IV drug use. Those are the kind of people that you will see that can have this extra, what I call it extra transmission. They already are having hepatitis B chronically, and then with a risk factor can acquire hepatitis D on top of that.
All right. Well, thank you for elucidating hepatitis D and E, and that's probably a good segue to talk about B. I was going to start with A, but let's start with B. So hepatitis B is a chronic condition. I understand that worldwide there may be as many as 343 million people infected, and that we're talking 750,000 deaths a year, and among those, nearly half are due to liver cancer. The prevalence, I believe, is lower in the U.S. than in some other areas, South Asia, for example. Any comments just on hepatitis B is in terms of a public health implication of this condition?
The implications that you have there is that when you have chronic inflammation of the organ, which is we're talking about today is the liver, you're making cells, and cells are regenerated and repairing themselves. In this process, you tend to get cells that turns into cancer, and that's where we get cancer in people with acute or chronic inflammation. What you also have to notice is that in hepatitis B, with chronic inflammation and infection, you develop hepatocellular cancer. In third world countries, we do not really pay attention to what we call screening and surveillance. When we talk about the screening and surveillance, for example, people that have hepatitis B, there are certain guidelines to care for them. For example, in African country, when they have hepatitis B, at the age of 20, you need to start doing ultrasound at least every 6 months. And once in a while, you can check alpha-fetoprotein. In Asia, a woman 50, you start doing your surveillance, and the men at 40. So those guidelines are there to look. But most of these third world countries don't have the resources, don't have the capability of doing the surveillance compared to the United States, where we have access to ultrasounds and lab such as alpha-fetoprotein, and then be able to do something very quickly.
How is hepatitis B transmitted, Dr. Obama?
It is transmitted through the blood, IV drug use. Sexual contact is also a possibility. But like we say, or we jokingly say, you have to have traumatic sex where people are both bleeding, where blood is involved. So those are ways. And then in countries where they give blood, such as where the blood is not screened properly, you can also get hepatitis B. Surgical equipment that are not properly sterilized. So when I see a patient sometimes from other country, my first question is, did you receive blood in your country? Did you have any surgical procedure done in your country? And you tend to see this not only in Asia, but you see it in Middle Easterners, where they come in with hepatitis B, but secondary to surgical procedures or blood transfusion.
And what is the incubation period after the exposure?
Usually 60 to 150 days.
So an individual might be exposed and develop symptoms quite a bit later.
Exactly.
And what are the symptoms?
Symptoms are usually what we call malaise. You feel tired, just no energy in doing anything. And sometimes if you are in acute phase, you can become jaundice, which means you become yellow. And then your stool clay-like in nature.
Yes.
Rather than the yellow, regular yellow stool, you get a clay-like stool. And then some people may develop abdominal pain or not.
What is the prevalence of hepatitis B in the United States? I mentioned the enormous worldwide burden of this disease, but what percentage of Americans might be chronically infected with this condition?
If I have to take an estimate of that, I think it's, I would say, close to about 30 to 40%.
Really, that's amazing. I was under the impression in looking at the literature that the prevalence of chronic infection in the U.S. is about 1%. Whereas in Asia and Africa it's 5 to 10%. However, I guess what might be confusing here is the majority of people who are infected with this virus clear the virus.
That's very correct.
About 90%, except for, I believe, in newborn children, in which case the rate of clearance might be quite a bit lower, perhaps only 10%.
Yeah, because the immune system is not matured.
It's not matured.
And as the immune system matured, things tend to change a little bit.
So this is much more of a problem in third world countries, particularly South Asia and Africa. We do have a vaccine, though, do we not?
We do have a vaccine, and I'm going to try to be politically correct. I think Cuba has made a very headway on producing hepatitis B vaccine at a very, very low cost, and are now helping a lot of other third world countries like Africa with this hepatitis B vaccine. Right. So the vaccines are usually in the 3 series. And then after the 3 series of the vaccines, you can go back and check for antibodies.
Right.
If the antibodies are still low, you can always give a booster.
Right, and without getting into the details too much, a natural infection will give one kind of antibody, anti-core, whereas if you are successfully immunized, you have a different kind of antibody. I believe we call it anti-surface.
Yeah.
And so you can actually be immunized. There really is no reason why anyone should be unprotected against hepatitis B in the United States.
That's very, very correct. The vaccines are there. And people, I think it's now becoming a compulsory issue that before you get into any school, you have to show documentation of vaccination. But like I always say, we are now in a global world where the influx of people from different countries has become much easier compared to the past.
Quite so. And I remember this vaccine came out in 1989, and you and I were already physicians, and there was a big effort to make sure everyone was vaccinated. But now really this should occur in childhood. And if there's one lesson from this show, it's that you should be immunized against hepatitis B. Your children should be immunized unless there's some overwhelming contraindication. Would you agree?
I agree with you.
Well, if we could change the subject, let's change it to hepatitis C.
Okay.
Because it's a similar condition. It's also, how is it transmitted, Dr. Urbano?
It's also transmitted via the same pathway, IV drug use, tattoos, blood products that are not properly screened and processed, surgical equipment as well, can also be a nidus, or rather a source for the transmission of hepatitis C. And hepatitis C tend to be more prevalent in the United States for reasons we don't know, but my guess is that the social life in the United States, we are the free social life where you can pretty much do what you can do by, people injecting drugs in their home environment or in different places, compared to some third world countries where injecting drug is considered a taboo and is considered a criminal act. So I think that makes the difference between the United States and other countries regarding hepatitis C.
I imagine that that's an enormous issue that, sociologists and anthropologists and public health officials could probably endlessly debate, but to be sure, we have a prevalence in this country of hepatitis C, which I believe is 2%. So in the United States, there's more hepatitis C than hepatitis B.
That's correct.
And historically, hepatitis B was called serum hepatitis. Hepatitis C was called non-A, non-B until we identified the virus.
That's very correct.
So I think the numbers in terms of total cases worldwide for hepatitis C are 170 million people chronically infected, with up to 500,000 new chronic infections a year. And particularly, I think the baby boomers in the United States are at high risk because there was experimentation with drugs on the part of many older people in the 1970s and 80s.
And the 60s.
And they are now finding that they might be infected. The rate of infection of hepatitis C is enormously high, even with a brief period of experimentation if you're using intravenous drugs.
That's very correct.
And to some extent, snorting drugs. But I believe the sexual transmission, although possible, is a little bit less likely to occur with C than B. Would you agree?
Very much agree with you. And like we always say, it has to be a traumatic sex for you to be able to transmit hepatitis C to somebody through sexual encounter. Traumatic sex in the sense that there has to be open area, open wounds, bleeding and so on and so forth. Usually it's very, very rare to get hepatitis C from sexually contacts.
And in terms of liver transplantations in the U.S., what is the number one cause, hepatitis C or B?
Hepatitis C.
That was my impression, so yes. And in an individual with hepatitis C, you will put them on a transplant list, right?
We will put them on the transplant list. It depends on several issues. You can do a biopsy and see if they have fibrosis or if they are cirrhotic. So if they are cirrhotic, then you put them on a transplant list. But if they are fibrotic, then the tendency to watch and see what they do. Now you don't have to even do a liver biopsy anymore. You can do a fibroscan or a fibrosure scan that can give you stiffness of the liver to indicate fibrosis or cirrhosis.
Right.
And not only that, today we are now having excellent treatments that can cure hepatitis C. in these people.
I should point out, too, that the rate of naturally clearing the virus is much lower in hepatitis C than in hepatitis B.
That's correct.
So that in hepatitis B, perhaps 90% of adults will clear the virus. In hepatitis C, I think it's only about 15%.
That's correct.
And among those who have chronic infection, 27% may develop cirrhosis and 25% may develop liver cancer.
That's true.
Now, do we have a vaccine for hepatitis C?
We don't have a vaccine for hepatitis C.
Do you see one developing in the future?
With the recent treatment that we are going, I would very much doubt, because it's been quite a while that we've identified hepatitis C. And up till now, we've still not been able to make a headway in developing a vaccine for it.
Okay.
Yeah.
We'll keep an eye on that.
Yeah.
Our time is running a little bit short, but I want to touch on hepatitis A.
Okay.
There was a recent outbreak of hepatitis A, I believe, in Los Angeles associated with the homeless encampments. Tell us about hepatitis A and how it's transmitted.
Hepatitis A is transmitted via person to person, a person that has hepatitis A. It's also transmitted from contaminated water, from feces. You can get hepatitis A. These people living in LA with the outbreak, sanitary condition was very, very poor. So there was no sanitary condition, no tendency for people to wash their hands after the use of bathrooms and all this stuff. And then from contaminated food. So I think those are the sources that led to the infection of this hepatitis in this group of people.
And usually, although you're miserable and you can have hepatomegaly and jaundice, you will eventually get over hepatitis A in most cases. There are occasional deaths, are there not? Occasional?
There are occasional deaths where you have what we call a fulminant liver failure from the disease, but mostly people that are immunocompromised, people with other diseases can be a culprit.
Now, if I recall correctly, we have a combined vaccine for hepatitis A and B now. Is that correct?
Not widely used.
Not widely used.
Yeah.
But you can be immunized against hepatitis A.
That's very correct.
You could be immunized against hepatitis B.
That's very correct.
But you cannot be immunized against hepatitis C.
That's very correct. But there are good treatments.
Good treatments.
For hepatitis C now.
So as we approach World Hepatitis Day, do you have any general advice for our viewing audience on how we can really try to minimize the impact of hepatitis on citizens both here in the United States and worldwide?
Yeah. For citizens in the United States, my thing is that if you immigrated from third world countries to this place, my suggestion is to get tested. Once you are tested, there are treatments for hepatitis B. Sometimes you have to take these medications for lifelong. And then if you are from other countries, my tendency is to advise or recommend to be tested. If you're not tested, you cannot know if you're infected or not. And two, the usual precautions. Today, we see marijuana smoking, tattoos are becoming very prevalent in young people. But at the same time, you have to pay attention to where you get your tattoos. You have to pay attention to how do you get your tattoos. And when you share needles, I think this country has been very, very fortunate where they can give you needles. You can go to places where you get exchange. Places in Berkeley, you can go in and get clean needles if you're an IV drug user. But in third world countries, you don't have this tendency. And then if you go overseas, be very careful about blood transfusion, surgical procedures, and all those kind of procedures. You have to be very, very careful of those.
Yes, you know, Emmanuel, we recently had a show on male health, and we talked about stigma and the importance of overcoming fear and stigma that might make us reluctant to seek help, whether we're men or whether we're women. And in the case of hepatitis C, there are some really high-profile individuals who have been found to have an infection. The famous pathologist, he was associated with assisted suicide, but he's still famous as a pathologist, Jack Kevorkian. The actress Pamela Anderson, Robert F. Kennedy Jr. So there are people from all walks of life who may be infected and may be unaware of it.
That's correct.
So it's important to overcome that fear and that sense of stigma or embarrassment and be checked.
Well, you can go to your primary care physician who can test you and then initiate treatment. But one thing we are saying is that some of these diagnoses we made with hepatitis C are incidental finding. where you do a lab work on a routine health care, what quote we call transaminase, ALT, AST, they are elevated. And at that time you begin to seek, why are these enzymes elevated? The enzymes are secreted from the liver injury. So once those enzymes are secreted from liver injury, you tend to check and see why.
Okay. Well, Dr. O'Banner, you're in practice in Stockton, I believe. Is that correct?
That's very correct.
If any of our viewers wish to get in touch with you or your colleagues and to be assessed for possible hepatitis or other issues in gastroenterology, how might they reach you?
They can reach me at San Joaquin General Hospital at the GI clinic. It's easy to call and make an appointment, and then you'll be docketed, or you will, rather, let's put it this way, you'll be given an appointment, and then it's easy to see us. And we can run all the sets of labs and then make recommendations to you.
Dr. Emmanuel O'Banner, thank you so much for joining us on Health Focus. We've tried to address hepatitis, and it's really an enormously complicated issue, but I think we've shed a little bit of light on it.
Yeah, thank you for having me.
That's been
and
a
I
pleasure.
hope people that watch the show can go to their primary care physicians to be tested and make sure that they also get their vaccinations. And if they are traveling to any third world countries, to make sure that they get vaccinated against hepatitis B before traveling.
Absolutely, because we're all about prevention here
That's
at Health
correct.
Focus. And remember, here on Health Focus, we focus on your health. And we appreciate your joining us for this half hour on World Hepatitis Day. Until next time, stay healthy out there. Thanks for joining us.
Thank you.